I'd like to first of all say I'm absolutely delighted to be here presenting this work today. I feel very privileged for the work that I do with patients and carers and healthcare practitioners. And I'd very much like to thank the All Ireland Institute for inviting me here today during Palliative Care Week. I'd also really very much like to say thank you to you for attending, because I know that this month is an extremely busy month for people returning to work, and for those of you who are working in healthcare, it never stops really. And those of you in universities, students are starting to come back, and so I do acknowledge it's very, very busy. As Clodagh said, I am a reader in the School of Nursing and Midwifery. I'm also a renal nurse, and I have worked as a renal nurse for many years, and mainly in London, as you maybe can tell from my accent. And most of my clinical work was done at the Royal London Hospital in Whitechapel, which is a fabulous part of London, a really ethnically diverse part of London, and has a very large Bengali population. So it was a really, really interesting area to work, and we're continuing to work with the Royal London Hospital. I'm going to talk to you today, though, about the Renal Arts Group and why we established the Renal Arts Group, how it was established, and to share some of the work that we've been doing and the projects that we've been doing. Okay, so before I start, I just want to talk a little bit about kidney disease for those of you perhaps who don't know very much about kidney disease and the impact that kidney disease has. But end-stage kidney disease is the final stage of chronic kidney disease. So if you are diagnosed with some form of kidney disease, you will be told that you have chronic kidney disease, and that will progress usually over time. And when patients reach end-stage kidney disease, they will require some form of renal replacement therapy to take the place of their kidneys that no longer work. So end-stage kidney disease is a condition, it's lifelong, and there's no cure. So what we can do is replace the kidneys, but we can't cure, we can't make those kidneys better. We can also offer kidney transplantation to patients, which is the gold standard treatment, but not everybody can receive a kidney transplant, and sometimes kidney transplants don't last very long. So the most common form of treatment is dialysis, and the most common form of dialysis is in-hospital hemodialysis. So here you can see a gentleman in a chair on a hemodialysis machine with needles in his arms and connected to tubing, and that tubing leads to, or it's connected to a hemodialysis machine, and over here on the right there is an artificial kidney, and his blood is removed and transferred through that artificial kidney, and that artificial kidney takes the place of the kidneys and cleanses the blood, and then that blood is transferred back into the patient. So the patient's restricted to a bed for up to 4 hours. They have to come to the hospital 3 times a week to have that treatment, sometimes for the rest of their lives if they're not going to get a transplant. And it's a really onerous and difficult treatment, not only because of the attendance at the hospital and the travelling up to the hospital and remaining on the machine for 4 hours at a time, but also because of the physiological changes that happen when you remove all of that blood from a person's body and then put it back in. People can feel really unwell. And when they finish their dialysis, they'll go home and they'll rest, and they might be feeling unwell, and the next day they might be feeling a little bit better, and then the next day they have to come back and do it all over again. So it's not unreasonable or it's easy to understand why patients might report higher levels of depression and anxiety and other mental health disorders than the general population. And we see that in our kidney population. And what we know is that depression in this population is a predictor of mortality in hemodialysis populations. So what we see is some patients who don't adhere to their treatment. Maybe some patients don't turn up for hemodialysis, and it's really essential that they do, because if they don't, they will accumulate a lot of fluid, for example, that will put a lot of burden on their heart. We see patients maybe not adhering to the very strict dietary regulations that they have to stick to, the medications that they have to take. Many patients take a very large number of medications that might cause side effects. We see maladaptive health behaviours, we see self-harm, we see increased rates of suicide, unfortunately. Okay, Clodagh, thank you. So that's a little brief background on end-stage kidney disease. And if you have any other questions, you can ask at the end or just put them into the chat. But how did the Renal Arts Group begin? So back in 2016, I'd been doing some work with a group of renal patients. I was a member of the Northern Ireland Kidney Patient Association. And I'd got to know one of the patients very well, William Johnson. And William had several transplants and had a very long history on hemodialysis, over 18 years. I may have that wrong, but it's at least 18 years or more. And William had begun to write poetry whilst he was on hemodialysis. And what he found was that really helped him to express some of his emotions, the difficult emotions he was experiencing. It helped him to communicate a little bit more easily with healthcare staff, and it passed the time whilst he was on dialysis, because there is this real problem with existential boredom of being on dialysis for 4 hours 3 times a week. And I was in the really privileged position of William coming to me with a book of poetry and saying, Helen, I just wanted to share this book of poetry with you. And I didn't really know what to do with this lovely book of poetry, which was about his time on dialysis and his and which really shared the emotional impact of being on that treatment. And so I said to William, perhaps we could maybe come together with a group of other interested people who were interested in the arts generally, and we could come together and form a renal arts group and maybe think about what we could do with the book of poetry. And that's what we did. And we started off as a very small group. We invited a couple of people who we thought might be interested, people who had an interest in nephrology, so kidney disease, and also had an interest in the arts. So, for example, a surgeon joined the group, a renal surgeon who is an excellent guitar player. A student joined the group who is a dramatist. We had a poet, we had an artist, we had members of the university, we had staff, and we had some patients. And we started off small and we met monthly or 6 weekly. And in 2017, we were very lucky in that we got some funding for Claire Carswell to undertake a PhD in this area. And I'm going to talk a little bit more about that. So that was a substantial amount of money, of maybe about £60,000, that really helped to allow us to move on some of the aims of the group. And then in 2018, we were again very lucky. We applied for funding and we received funding for an administrator of the group, because it just became too big and unwieldy with the projects that we were doing for the team to manage that. And we were able to make a case for an administrator, and the wonderful Anna Wilson came on board, and she's really helped to increase the remit of the group. Thanks, Clodagh. Okay, so the aims of the Renal Arts Group, we worked on these very early on. One of the key aims is to improve quality of life and well-being of people with end-stage kidney disease. And that's our overall aim. And we do that by using arts-based interventions. We also aim to give a voice to patients with kidney disease through the use of the arts, and we also want to make a social impact, and we want to engage the public. So we aimed very early on to work with the public by using arts-based interventions as well, and this we knew that would raise awareness of kidney disease in the public, and also of kidney transplantation. We also wanted to produce interdisciplinary work, so our collaborations have been with academic researchers, with staff out in healthcare, with policymakers, and with our patients and our carers. So I want to talk just a little bit about some of the events and projects that we've undertaken. So early on, we had a lovely event at the Ulster Museum in 2017, and we ran this event with the Northern Ireland Kidney Patient Association. It was part of the Creathon, which some of you may know. It's a big arts event that happens across Northern Ireland once a year. And we got our place down at the Ulster Museum, and we brought along some of the members of the Renal Arts Group and members of the Northern Ireland Kidney Patient Association. And we had an artist who, I think if you can see them here, these little butterflies, they're the emblem of the Northern Ireland Kidney Patient Association. And we got the public to colour them in and write little mock slogans on the butterflies. And then we put those onto string and we hung them up, and we had this lovely butterfly, I don't know what you would call it, but butterfly creation hanging from the ceiling of the Ulster Museum, which was absolutely lovely. And then I brought along some children, and they had guitars, and they did guitar lessons with the public. And we just had a number of different events, and William had developed some of his work into an on-screen short play version, and so we put that up as well, and people were able to watch that. And that was a lovely event at the beginning to kind of raise public awareness of what we were doing. And then in 2019, we had another excellent event at the Sunflower Bar in Belfast, and this was just fabulous. It was an arts and health show care event at the Sunflower Bar, as I say, and funded by the ESRC Festival of Social Science. And that was just an amazing event because it enabled members of the Renal Arts Group to come together with policymakers, other patients, other carers, healthcare staff, and members shared some of their art. So William talked about his personal journey and the development of his poetry and plays. We had another patient who presented his photography. We had a member who presented a dramatic piece of work. We had some poetry, and we had lots of laughter, and we had lots of tears, and we had pizza. And as William would say, it completely broke down barriers, many barriers. It was a really lovely event, and it's just at our Renal Arts Group yesterday, actually, people are talking about recreating that event now that we've come out of COVID. So we're hoping to do that. The other thing we've done is we've branched out a little bit to include mindfulness in our work, because I do believe very strongly that when you undertake an arts activity, whether it be playing the guitar or painting or whatever, you become very mindful. And mindful is about being very aware of what's happening and being in the present moment rather than the past and the future. And so I see mindfulness as integral to all of this work. And so we had a mindfulness at the museum and mindful yoga event. The mindfulness at the museum was absolutely lovely. And we had somebody from the museum bring us around and introduce paintings to us. And then there was an arts activity afterwards, and again, a lovely lunch. So we always include some nice food and some socialising. And then we got some funding for the Starman project, and this allowed for William to be mentored by a scriptwriter, Shannon Yee, who's very well known throughout Northern Ireland. And that project's in development, and I'm going to talk a little bit more about that a little bit later. And Shannon has also developed and offered script writing sessions to patients, carers, healthcare staff. So we've had a number of different projects, and that's just an example of some of them. Thank you, Claude. Okay, so we worked with a company called Science Animated. We wanted to create a short video to describe the work of the Renal Arts Group. And again, we got some funding to do this. And I'm going to ask Claude in a second to play this. It's a very short video. It's only 30 seconds, but it will just give you a very short overview of what the Renal Arts Group is about. Thanks, Claude.
Dialysis is life-saving but brings many challenges. Sometimes dialysis impacts patients' mental health and quality of life. Research has shown that engaging with the arts can boost mental health and well-being. Through art, the Renal Arts Group at Queen's University Belfast aims to improve the quality of life of people with kidney disease. Since 2016, our work has helped dialysis to become a less lonely, more positive experience. Participation in arts programs can transform a sterile clinic into a place of inspiration, productivity and joy.
One of the great things about that video is that we all worked on it together. The background music was done by one of the members, so the surgeon, the guitarist, he put together the music, and Paul Sibley, who was one of our group members who has recently been transplanted, which is absolutely lovely. He created the beautiful kidney, colourful kidney. So many people participated in putting this together. Thank you, Clodagh. So I want to talk just briefly about another funded project that we have undertaken during COVID. So this is the Create and Connect project, where we've developed online arts-based interventions that were aimed at supporting the mental health and well-being of patients with end-stage kidney disease. Clodagh. Okay, so patients with end-stage kidney disease were very heavily impacted by COVID-19. Due to the nature of their disease, they were deemed very clinically vulnerable, and they were asked not just to isolate but to shield at home, and that meant very limited face-to-face contact with anybody. They needed to be shielding in a room away from anybody, and that was really difficult for many of our patients. And we felt that perhaps if we put together something that would help pass the time for these patients, and that might be helpful. So our initiative was about developing some online arts-based activities, and we would then offer them virtually and hopefully provide some mental health and wellbeing support for these patients who really faced a very long period of self-isolation as they shielded. So we coordinated a number of online workshops and tutorials. So there was a combination, and we made them available to the wider renal community. We have a website which Anna has developed. It's lovely, and I'll send you the link to that later. We've got it in the presentation actually, and I would really encourage you to go and visit the website. There's a lot of resources there. And we worked with experienced art practitioners who we'd got to know really through our work, and we developed these activities which included printmaking, creative writing, songwriting, blues guitar and watercolour painting. And these activities were made available once a month, and we kind of rolled them out between October 2020 and April 21. And they were either delivered via Zoom, which we've all got to know very well, or there was a pre-recorded video made available. So I've got a short example here of one of those videos, the printmaking. So it's very short. I think it's only about maybe 90 seconds. So again, as Clodagh said, if you maybe turn up your volume and just get prepared, it just give you a little taster. I've got another taster right at the end, but this is the printmaking one. Thanks, Clodagh.
Almost sticks to it really effectively, and other foliage, you know, the ink doesn't sit so well on it. So I've coated my foliage with a nice even layer. Again, face down. Now this is where I could use a bit of fabric, so I will. I'll use my little bit of calico here, because I might get a bit of a print on this, so I might get like almost 2 for 1. I do usually just use kitchen roll, but for the purposes of this demonstration I'll show you. So again, holding it in place, I'm going to use the spoon and I'm just going to go over it. Now of course, if you're using a printing press, you'd be rolling the foliage and your fabric through your press, but But because we're printing from home, we're printing by hand. If I'm using the Baron, again, like so, and my hand. So I'm really going to focus on making sure I get that stem printed. Lift it up. Lovely, got a lovely mark on the calico. That's really, really nice.
Thanks, Clodagh. So it just gives you a little sample of what's on offer. Okay, so thinking about impact, it's always really important to think about the impact that we might be making. We, to date, have received over 1,200 views of our arts activity, and that kind of just increases day by day. 91% of participants have rated the activity that they undertook as a 4 or 5 out of 5 as being beneficial for their mental well-being. 100% of our participants rated the activities either 4 or 5 out of 5 when asked how much they enjoyed the arts activity. So there's a lot of enjoyment going on, and 100% wanted to do more, which is excellent. Thanks, Clodagh. We've also had some qualitative feedback about these online resources, and I'll just read out a couple. The one in the middle there: I feel in a peaceful place or space as all my mind and concentration is on my art. So that's very much that mindful bit that I was talking about. The session felt almost therapeutic, getting thoughts out of my head onto paper and being creative. It felt really good for the first time being part of a group online, all interested in the same thing, sharing that passion. And I love that quote because I really believe that art reaches something inside us, and I sometimes don't have the language to explain it, but whether it's your heart or your soul or whatever, when you take part in an arts-based activity, or when you look at a beautiful picture, or when you watch a fabulous film and you feel tears come into your eyes, or you feel a surge of something inside you, there's something beautiful happening. And I think that's what life's about. And I think that's what the arts can really get at. And when you can sense and feel that, I think you change and you become more aware of your humanity and your shared humanity. And when you do arts together, as this quote, this person has said, you start to share in something really special. When you go to the museum as a group and you're looking at a piece of beautiful art, you start to share in something really special. Okay, thank you, Clodagh. And we also did some interviews with the arts facilitators to see what their experience was and what happened with them when they provided the resources. And we had these 3 themes. So the first one was accessibility. So if I just read out a couple of the quotes, I had to figure out an exercise that was going to work, but work for multiple different people on their own, in their own house. So the artists had to really think about how were they going to make the activity accessible to people online during COVID. The second theme was around audience engagement and the impact on health and well-being. And the quotes here: some of the writing might have touched on or brought up some unpleasant memories of trauma or of medical experiences that were unpleasant. It was also a safe space in which people felt a sense of community. So when you participate in arts-based activities, some of them, as they touch upon these more in-depth emotions, experiences, it can be a little bit traumatic, and that's what the artists were recognising, and they were able to support people in the environment to maybe be aware and to talk where they felt happy to talk. And then we looked at facilitator experiences, the challenges and the opportunities. Well, one said, a year ago, I would have thought you can't do this, particularly arts and especially music. You can't do this. I pivoted completely in my views. And COVID has bizarrely, positively opened up opportunities for me as an artist because people have moved online. and opportunities for workshops, professional development and work have opened up in ways that would not have been available previously. So the facilitators are starting to recognise that things could be done online, they could be done really well. Thank you, Claire. So I just wanted to mention some of our project partners. We work with a number of different people, but I'd like to acknowledge Kidney Care UK, and Kidney Care UK are the UK's leading patient support charity for kidney patients and their families. And they've hosted activities that the Renal Arts Group put together on their website, and they've got 6,700 social media followers, so that's really helped us. They tweet and they put things on Facebook. And we've also worked with Kidney Beam, so that's an online wellbeing platform. It's quite new, it's for the kidney community. It's absolutely fabulous because they offer free yoga sessions, free exercise sessions, etc. But they wanted to expand with their wellbeing focus into the arts, and so they promote our activities. And then we work very closely with the Northern Ireland Kidney Patient Association. So that's a Northern Ireland-based charity for patients and their families, and it's run by volunteers and it's run by patients and carers. And they've promoted our activities to over 1,900 members. Which is excellent. Thank you. So I'm going to talk a little bit more, just for the last 10 minutes or so, about some of the research that we've been doing. Claire Castle, I mentioned her. She was a PhD student. She's now a research fellow working with me and doing some fabulous work in this area. She carried out a feasibility study looking at art on hemodialysis. So what she did was she created an arts-based intervention. She brought it into a hemodialysis unit, and then she looked at how feasible it was to run the intervention. And what she found was that the intervention was very acceptable. People were very happy to take part in the arts-based intervention. It was very feasible. She could do it. She could run the work in the unit. It was very safe. It didn't interfere with the machines or the working of the hemodialysis unit, but patients said it wasn't enough. They wanted a little bit more. Okay, Clodagh. And what I want to do now is just briefly talk to you about the process evaluation that Claire carried out at the end of this study. And the process evaluation really is a set of interviews that we did with patients, carers and healthcare professionals. Her whole study was carried out in the haemodialysis unit at the Antrim Area Hospital, and I'd like to acknowledge all the staff there for their participation and all the patients there, and particularly those who took part in the arts-based intervention. We carried out 22 interviews with patients and healthcare professionals, and I'm going to talk about what we found through those interviews. Okay, Clodagh. Okay, so 4 themes were identified once we analysed all of that data from those 22 interviews. And the 4 themes were based around, number 1, perception of art participation. So what do people think about participating in art? There was also a theme around the effect of the arts-based intervention on patients and healthcare professionals. There was also a theme around how acceptable the arts-based intervention was in the unit and how acceptable were the research procedures, how acceptable was it to be recruited, etc. So I'm just going to talk about the second theme because there was an awful lot of data generated, as I say, and I'm going to talk about the effect of the arts-based intervention. And so within that theme, there were some sub-themes, and the first sub-theme was the generation of positive effect due to exposure to the arts-based intervention. So people felt better when they were exposed to the arts and the intervention and to the activity that they were undertaking, whether it were painting or drawing or whatever it was, whatever the activity was. So here we have a quote from a patient, very relaxed and away from me, well, not leaving all my worries behind, but just sort of made me a lot more relaxed than I would be. And then a quote from a healthcare practitioner, talking about their work and all, you could just see their whole face light up and just expressing how they did it and how they enjoyed it. So just this very positive effect that patients experienced and healthcare providers acknowledged. There was also evidence of improved self-esteem. So this patient said, well, I would say a lot of people who didn't think they were arty got into it. And, you know, they were rather pleased that they did. Now, they wouldn't be a bit scared about now. They wouldn't be a bit scared about lifting up a pen and pencil and drawing something, you know. You always get the ones who say, oh, I can't draw, but really they can. And that was a really important point, actually, because to begin with, Claire did find it quite difficult to recruit patients because many felt that they couldn't do art. They'd never done art. They had really bad experience, perhaps at school, lots of different reasons for why they couldn't participate. But some were a little bit braver and they did launch themselves in, and once they did, there was no turning back. And once they did, other people in the unit started to watch and started to think, perhaps I could do some of that. Okay, thanks. Okay. The other effect that we saw was impact on a sense of purpose. And sense of purpose is really important because we know from the research literature that patients who are diagnosed with end-stage kidney disease, who have to come for dialysis 3 times a week, who perhaps lose their jobs, who perhaps see big changes in their family dynamics, sometimes lose this sense of purpose. They wonder what their purpose in life is. And the art gave people a sense of purpose. So this patient said, well, it gave me something to go for, like a goal. It gave me a goal to go for. You go for that and you keep going for it. And healthcare practitioners said, well, you could see a difference in patients, even at the reception, by them talking and saying, oh, what did you do the last day? And what are you going to do today? And you could see the excitement in them. And it got the patients more looking forward nearly to come and see what they were going to do and see how they were going to learn. Let's close it. And then there was increased social interaction, which is really important when you're quite isolated because of your kidney disease, perhaps isolated on your kidney machine. First patient said there was somebody there to talk to. The talking was just as good as the art. Well, it's just I love the company of Claire, the facilitator. The company made a great difference. So there was something about the facilitator having that one-to-one time that patients really appreciated. And the healthcare practitioner said, a good change, though. It was very good. They were more chatty afterwards. They were a very closed little book beforehand. But then once they started to do this and you asked about it, then it kind of opened up and you learned a lot more about the patients. So there was an opening up as well. And again, I think just finding this place inside you that's one of beauty and just grace and allows you to open up. There was also a positive impact of the arts-based intervention on the dialysis experience. So the first patient says, you were doing something with your hands. You were focusing on trying to do this well, because I was doing something instead of just lying there thinking about different things. Your mind just goes, it goes from one thing to another and, you know, thinking back to the past. And I think that's a really, really important point because this is what happens. Patients are on dialysis and time passes slowly, thoughts race, accumulate, and we know, again, from the evidence, as thoughts accumulate and you worry and you fret, you get stress, and then that stress increases, and then you get burnout, and then you get mental health breakdown. That's what happens. That's how simple it is. So the art interrupted that. People felt that there was a little bit more to the dialysis session rather than just coming on and being on the machine and sitting there. And this quote from a healthcare practitioner, this is sort of taking it to the next level and saying, it's not all about dialysis. It's not all about kidneys here. We're looking after you and we're seeing what can benefit you positively here. Thanks, Brona. Claudia, sorry. Okay, so that's the process evaluation. That's just a short summary of one of the themes. We're at 10:40 now, so I'm going to just speed through this last bit. This is a I want to talk about some money we got from the ESRC to think about impact and how we take the work forward. And we wanted to develop some guidelines for units so that they could deliver an arts-based intervention using volunteers. We decided that would be a good way forward. So what we did is we brought together key stakeholders from the Northern Trust, from the Renal Arts Group, from the Northern Ireland Kidney Patient Association, and we had a number of advisory group meetings. Then we had a workshop to refine the guidance that we'd all put together. We did that across the UK, and we're in the process now of dissemination with the development of an animation, which you saw earlier for the Renal Arts Group, and an infographic, which will describe very briefly the guidance. We had to think about remote provision and direct provision because of COVID. How could we remotely provide this intervention, offer people an arts-based intervention using a volunteer remotely, and how could we do it face-to-face? So the guidelines covers both. Thanks, Clodagh. And thinking about what's needed in a volunteer, we didn't feel we needed a professional artist. We felt an enthusiastic amateur was what was perhaps required in a volunteer, and that they would provide a caring service, maintain client safety, comply with infection control, be very committed, regular attendance, and maintain confidentiality. So those were some of the core components that the person would need to be able to demonstrate. We talked about the training that they would need, and we talked about the supervision and who would best be placed to supervise volunteers. And so we came up with some guidance, and we've written up that document, and we're about to write it up into a paper for publication. So you will be able to access that, but I will also get that document to you if you're interested in that guidance. And we will, as I say, have the short video and the infographic coming very soon. And finally, I think this is the last slide about our research and implementation. Oh, sorry, Clodagh, well, it doesn't really matter, actually, stay there. I want to just briefly mention that we have just submitted an NIHR application to run a randomised control trial, a cluster randomised control trial of an arts-based intervention, of the arts-based intervention really that we developed during Claire's study across the UK. And Claire and I have submitted that together. It's valued at £1.3 million. We're keeping our fingers crossed if you could all do that for us. And I just think it's absolutely amazing that we've moved from 2016, William and I, looking at his poetry, to today, where we've been able to submit a grant for £1.3 million. And that is what has happened through our journey, really, and developed through our journey with the help of the Renal Arts Group, which has just been an absolutely amazing journey. We started off with, I think, about 6 participants in the Renal Arts Group. We now have close to 40, and we have an international group. COVID really opened that up for us, and all our meetings are online. And I would like to just say, keep in touch. We're on Twitter, we're on Facebook, we're on Instagram, and we're going to I'm just going to show you a last short video. This is Anna Wilson, our Renal Arts Group administrator, and her daughter Lucy. They put together an online video for use as well. It's only 30 seconds. It's very, very short. Do you want to play it, Clodagh?
Hi everybody, I'm Anna. I'm the administrator for the Renal Arts Group.
Hi, I'm Lucy and I'm 6 years old.
And today we're going to show you how to create a Kandinsky inspired circle artwork using watercolour paints. So Lucy, do you know who Kandinsky is?
Nope.
Okay, looks like we better find out who he is then.
Vasily Kandinsky was a Russian artist working at the beginning of the 20th century. He worked in an abstract style with a focus on shapes and colours. He felt that he could express feelings and music through the colours and shapes in his artwork and painted many pictures featuring repeating circles. Today we are going to create our own artwork inspired by Kandinsky's circle paintings.
Aha, so there's just a little taster, and you have to go to the website to see the rest of that video. And I would really urge you to as I say, it's been an absolutely wonderful journey, but it's not me alone. It's all these other wonderful people who I've been blessed to work with. I can't name them all because then I'll forget some of the names, but all of the Renal Arts Group, all of the participants, I would just like to say a really, really big thank you.